All right, so today, have you ever thought, if we say yes to hospice, what do they actually do? Okay, what do they actually do? If we say yes, what does hospice actually do? Well, today I'm going to walk you through exactly what hospice provides for your patient, for our patient, for the hospice patient, for your loved one, your family member, so that you know exactly what you're saying yes to. We want to make sure it's clear, concise, there's no confusion, and we're going to cover all of that. So the big picture today, hospice is more than a nurse with meds. It's a team and a set of services designed to help you carry the load, okay? A set of services designed to help you carry the load. As always, guys, you know that I'm going to bring the notes, and I want to bring all the value today, so I've got that here. If you see me glancing off to the side, it's just for that reason. I want to make sure that we bring you all the value, and I wrote this out for you today. So, first and foremost, core clinical services, nurse visits. Now the nurse visits are for pain and symptom management and monitoring changes. You would have your own personal nurse that comes out as what we call an RN case manager. And they're going to be there for you, for your loved one, for your family member, but they're going to be monitoring medication adjustments, pain, symptom management. They're also the ones that order a lot of the medical supplies, and we're going to talk about that down low. But they're overseeing, they're case managing, they're your main point of contact. They will be reaching out to you after visits. If your loved one's in assisted living or memory care, they're like that bridge. Hey, hospice is here for you, and they're that point person. They're the quarterback of the team, you could say. I think that's a good way of looking at it. Now, then you have the aides, so the home health aides. What does a home health aide do? The aides do bathing, grooming, personal care, companionship visits. Oftentimes, again, the aide is going to be coming consistently twice a week. And then naturally, case by case, that may go up based on availability and what your loved one needs and how their care is progressing. With all services tend to pick up as the disease takes its progression, as we see more declines. There's going to be more time in personal care more towards the end of the journey than maybe per se the beginning. But the aides are like the backbone of bathing, grooming, personal care, keeping an eye on things so that they can report things to the nurse. Again, they're another set of eyes. They're also the one that the position, the person that will take the biggest load off of you, especially when it comes to those showers. If you're personally caring for mom and maybe showers are getting more difficult and you want somebody who is a CNA, medically trained, to come in and do that and assist and support, they're there to serve. They also do that in the facility setting, and they're a blessing all around. And aides are they're very compassionate individuals, and they're there in the backbone. Okay. Other core clinical services. So we have our on-call nurse 24/7. So you have someone you can reach out to nights, weekends, holidays. 24/7, huge. Again, if your loved one is in a facility, this is great for the facility settings, the nursing homes. Those nurses have a more specialized group of nurses they can reach out if they're concerns, if there are problems, or maybe in the past your loved one would have gone out to the hospital. You're not doing that anymore. Now we're going to send a nurse in to see what's going on, and they're on staff 24/7 around the clock. We have our after hours nurses team. That's how most hospices operate. And there's going to be somebody there. And especially if you're at home caring for mom and dad, this is the backbone for you, because you have somebody to call. You can either have them come out to the house and do an assessment. Maybe it's just getting some questions answered over the phone. Huge support. So 24/7 nursing staff. Again, guys, we're looking at if we say yes to hospice, what do they actually do? Okay. I want you to know and walk away and be like, wow, this is what they do, and what a blessing that might be in that season. So medications, what else does hospice do? We manage medications related to the illness. Now, again, we'll talk down the road about morphine and the big myth around morphine. And are they just going to put mom on morphine? No, that is rarely the case. Unless your loved one is coming out of the hospital and is very far along in their process and they need pain support, then we might look at it. But for the most part, we're going to stay on the meds that they're already on. And then we're just going to look at new medications or medication adjustments that will make your loved one more comfortable. And what I mean more comfortable, so that they can be more present with you. that they can be there alongside you and aware, and they're out of pain, which oftentimes allows them to do more things. So we look at pain medications, we look at all other medications. Sometimes, God bless you, but your loved one may be on 20 to 30 pills a day. And sometimes all of those different things just, they don't add up and they don't make sense in this season. And we can get rid of some of those things. You're in the driver's seat. We're going to talk through the med list with you or with the clinical staff at the facility. And we're all going to be on the same page, but definitely medication management, huge, especially, as time goes on. We want to keep your loved one out of pain. And we just want to make sure that they're feeling the best they possibly can. Medical supplies, so wound care supplies, big. If your loved one has some kind of skin condition or a wound, we're there to support that, as well as incontinence products. This is a big one for families, as you may have a loved one who is incontinent, maybe bowel, bladder, different things going on, and they need Depends, they need wipes, they need all of those things, and we know how expensive those are. Those are 100% covered under the hospice benefit. One of the things where families are like, wow, that was a financial relief. And so we cover that, we manage that RN case manager and the aide, they oversee it, and we make sure that you have those things on hand, on supply. Okay. So now we're moving from clinical services over to emotional and spiritual services. So hospice also includes a social worker for emotional support, family meeting, and planning ahead. So you have a social worker who comes in, walks you through this season as a family. This is oftentimes more for you and for your brothers, sisters, family members to make sure, do we have all the right legal documents in place? Do we have power of attorneys set up? Do we have, a DNR set up? All of those different medical things, and just there to help you navigate that process. And just be there. A big thing is emotional support. This is a journey as much for you, the caregiver, and the family member as it is for your loved one. I know personally for me, when we walked through it with my grandmother, and now my grandmother on the other side of things, as a family member, a social worker was a huge blessing because they could just bring perspective in a different way than maybe the clinical team could. And again, as I worked with seniors and families for 14 plus years in the assisted living setting, the social worker oftentimes just brought clarity for families as they walked through this. So huge benefit. Then we have our chaplain. Now our chaplain provides spiritual support, prayer, and oftentimes just can answer those tough questions. When we are at the end of life and your loved one's at the end of life and feeling, that mortality, that this season is coming to an end, and what is next. And as a Christian, as a believer, I believe that there's an almighty God and that heaven is next, and that is the plan, and that is where we're going. And hopefully that is the case for your loved one. But maybe it's not, and there's questions and concerns. That chaplain's there to support that. And if nothing else, okay, I just want to share, because sometimes that can be tough for some families, and I understand that chaplain is just another person, another friend to come in, talk, break down fears, answer questions, just be there as a friend and emotional support, and just there to also be just another set of eyes on mom and dad, and being able to also, again, report back to the clinical team, hey, this is what we're seeing, this is what's going on, and again, they're there to support your loved one. And lastly, we have our bereavement support. We have a bereavement counselor who does grief support after the passing of a loved one. Again, for you, your family, every family handles grief differently, but we provide that bereavement counselor to ensure that you're supported, after that time passes. So those are the core things of what does hospice do? What do we provide if you were to put your loved one on hospice? Where do the services happen is oftentimes a follow-up question. Services happen wherever your loved one calls home. So that could be physically in their home, or maybe they live with you and it's in your home. They also can go to assisted living and memory care units, as well as nursing homes. Sometimes it does happen at the hospital. That's not as common. We want to get potentially, back to where your loved one is going to be comfortable. But we provide, and we can follow, and we can also give recommendations and bounce between those settings as maybe more or less care is needed. Okay, so ultimately I want to recap today. Hospice provides nurses, aides, medical equipment, supplies, 24/7 support. these are the services that oftentimes families, from my experience, maybe didn't value up front. They were just scared of the hospice word. But after hospice came on, they're like, wow, should have done this sooner, James. Should have done this sooner. And again, I know it is a big decision. I was just speaking with a case manager at a hospital today about a husband who is considering hospice for his spouse, and what a major decision it is. It is. I want to acknowledge, and I want to acknowledge you in that place. If you're thinking, but James, this is a big call. Yes, it is. Yes, it is. And I want you to ponder and walk through, but I want to encourage this. I want to encourage that you step out in faith. I want you to be encouraged to step out in courage, and really, after hearing this video, understand that all of these things are in place and are 100% covered through the Medicare and Medicaid benefit and most insurances. And this support not only can potentially prolong life, there's no guarantee, but can make life last longer, but it's also there so that you do not have to bear this burden alone, okay? And this is the conversation that, when I talk with this husband this evening, I'm going to lay these things out as we talk through this big decision. His name is, well, not going to stay from a HIPAA standpoint, but it's important to understand that when I'm talking with him, that we lay these things out and understand and acknowledge this is a big decision, and it may be for you. But also, hopefully, this brought some clarity today. The emotional, spiritual, and grief support that covers your entire family. Maybe you're walking through this and you're solid, but you've got that grandson, your child, who's going to have a really hard time with this. We're here to support him or her as well, okay? All of this is aimed at comfort, dignity, and support. It's not just physical care. And so as we step away today, I want you to be blessed. I want you to walk away with the knowledge that there is a benefit out there that your loved one is paid for years through Medicare. That check pulled every month, it's paid for. It's taken care of. This doesn't cost anything. It's just the decision and stepping out and getting that evaluation and making that next step. So we're here to support you here at Hospice Peace University. Thank you for your time and your attention. And God bless you as we walk through this season. All right, have a great day.